Today we're out here in Colorado Springs, Colorado at the Clinical TMS Society Conference. Today we're going to be interviewing doctors and professionals, the people that know TMS the best. Today's question is, does brain stimulation work better than medication?
Brett Scotia, I'm the Vice President of Sales for NeuroCare, which we manufacture and sell the Apollo TMS system. I've been in the industry for over 12 years and have sold 10% of all the active devices in the world.
Is brain stimulating better than taking medications?
It's hard to say the word better, okay? I would just tell you that if you just look at in the initial trials that were done for TMS, they had patients that had failed an average of 4 meds. And in that group, if you look at STAR-D, which is the largest trial ever done in psychotropic medications, 4,000 patients in over 7 years, the group of patients that was on the 4th medication had a 6.9% chance of remission. When you gave them TMS, that group had a 33% remission rate. So, you know, I'm not going to say it works better, but the numbers, 33 versus 9, is pretty impressive. And I'd love to see where this was at if it was ever used as a first-line treatment, what you could get if you tried it that way.
Yeah, I agree with you on that one.
June from Yingzi, the VP for Yingzi.
Is TMS therapy going to be better than taking a medication for these drugs, right?
Yeah.
Or for these symptoms, right?
Yeah. The most advantage for TMS we saw from here is it have very less side effect. But for the meditation or the drugs, it have a lot of long list, and maybe some give other fell asleep or something else. Yeah.
My name is Rayma Wright. I work with Seberg's Medical. It's a German-owned company. He's been in TMS for 14 years.
Does brain stimulation work better than standard medication?
Yes, it does. Medications can make you drowsy. They can give you side effects, you know, to where actually it worsens your depressions because of the side effects. Transcranial magnetic stimulation does not have any.
Yes, my name is Crystal Luca. I'm the Director of Operations and Director of Training for Peak Logic Inc., which is a medical software company as a medical device. And we offer PRTMS, which is personalized repetitive transcranial magnetic stimulation.
Is brain stimulation better than taking medication?
You know, while some people need to take medication, I'm not going to, doubt that or knock that. However, in my opinion, for myself and my loved ones, I would choose TMS over medication option. Medications that you take, it's systemic. It affects every organ in your body. It comes with side effects. Usually, if you want to maintain the benefits you're getting from a medication, it requires you staying on the medication and it being lifelong. Whereas TMS is not systemic, it's local, right? And so it's directly impacting the source of one's symptoms. So by correcting the symptoms, or correcting the source of the symptoms, you're able to go through a course of TMS or PRTMS treatments and usually see benefits that are long-lasting. Now, maintenance treatments can be needed. However, it's the alternative to medication that has less side effects and isn't lifelong like meds are.
Wonderful.
Yeah, so my name is Jake Buchanan. I own a company called TMS Marketing Solutions, to where we help TMS practices find more TMS patients.
Do you see brain stimulation actually working better than medications?
So another great question. So not a medical doctor. Once again, I'm going to say that again. So hopefully that's very well
You got to give
known.
that disclaimer.
Hopefully that's very, very well known. But from my own layman's perspective, it works best together, actually. And so there's no one fix to an issue, and it's important to let your doctor, let your provider, use the tools in their toolbox to be able to find the right solution for you. And if you give up too early and you say, no, none of this is working yet, I'm tired of dealing with this, then, you're not really giving it a shot for you to have success, for you to be happy. So I wouldn't rate one over the other, but what I would say is if you tried medication and it hasn't worked for you, then you should certainly give TMS a very strong look. And it doesn't mean that you're going to come off of your medication. In fact, most providers will keep you on your medication while you're going through TMS.
Hey guys, if you found that video informational, want to see more, do me a favor, click this video right here while I enjoy my TMS sessions. Did you click it? Click it already. TMS. It's life-changing. This video right here is going to help you.